Blood pressure medications, such as amlodipine, losartan, and lisinopril, are not simple or ordinary drugs. They are powerful medications that directly affect the heart, blood vessels, and kidneys. Amlodipine works by relaxing and widening the blood vessels so that blood can flow more easily, which helps reduce blood pressure. However, one of its common side effects is swelling in the ankles and lower legs, which many people mistakenly assume is related to heart or kidney failure. Losartan and lisinopril work on the body's blood pressure regulation system in a different way, by blocking or modifying hormonal signals that tighten blood vessels. These medications can sometimes increase potassium levels in the blood, which may become dangerous in certain situations, especially when combined with potassium-rich salt substitutes or supplements. Lisinopril may also cause a persistent dry cough in some people, which can last for weeks or even months, and is often mistaken for allergies or respiratory problems. In rare but serious cases, it can cause swelling of the face, lips, or throat, known as angioedema, which requires immediate emergency medical attention. Another important aspect of these medications is how strongly their effects can change depending on the condition of the body. When a person becomes dehydrated due to illness, vomiting, diarrhea, or extreme heat, the same dose of these blood pressure medications can become too strong, leading to a sudden drop in blood pressure and putting extra stress on the kidneys. Common pain relievers, like ibuprofen or naproxen, can also increase the risk of kidney problems when taken alongside these medications, even though they are easily available over the counter. This is why it is not enough to only understand the medication itself. It is equally important to consider lifestyle, diet, hydration, and other drugs being used at the same time. Blood pressure is not a fixed number, but changes constantly with sleep, stress, food, and daily activity, so treatment decisions should always be based on consistent patterns rather than a single reading. Any unusual symptoms, such as repeated dizziness, significant swelling, or breathing difficulty, should never be ignored and should be discussed with a doctor immediately. It is also important to understand that blood pressure medications are designed for long-term, steady control rather than quick or as-needed use. Many people make the mistake of reacting to a single high or low reading by changing or skipping doses, but this can actually create more instability in blood pressure. A single reading is influenced by many factors, such as stress, caffeine, pain, sleep quality, recent activity, or even anxiety about the measurement itself. What truly matters is the overall trend over time, measured under consistent conditions. This is why doctors often recommend checking blood pressure at the same time each day, using the same arm, and after resting quietly for several minutes. When readings are taken inconsistently or interpreted emotionally, it can lead to unnecessary fear, wrong self-adjustments, and unsafe decisions, like taking extra doses or stopping medication without medical advice. Another key point is that these medications interact with everyday life in ways many people do not expect. Even common over-the-counter drugs, especially anti-inflammatory pain relievers like ibuprofen or naproxen, can affect kidney function when combined with blood pressure medications, particularly in older adults or during dehydration. Simple conditions like fever, stomach illness, hot weather, or not drinking enough fluids can significantly change how these medications behave in the body, sometimes causing blood pressure to drop too low or increasing strain on the kidneys. This is why doctors often advise having a clear, sick day plan for what to do with medications during illness, although many patients never receive this guidance. Understanding these interactions helps prevent complications and ensures that treatment remains safe, effective, and stable over time, rather than becoming unpredictable during everyday life changes. It is equally important to recognize the early warning signs that may indicate your blood pressure medication needs adjustment or medical review. Symptoms like frequent dizziness when standing up, repeated near fainting episodes, unusual fatigue, or